Hello, everyone, and welcome to another episode of ComplyPlus Presents. So it's very strange today because I'm leading.
You're sat in a different country, it feels, over there, yeah.
Well, how does that feel in the hot seat?
Well, it's just more cameras on me, yeah. So, no, I don't mind. I've got a slightly different view of the studio.
Yeah,
So,
yeah.
no,
I think you
it's
get
nice.
used to one angle of the studio. Even now, I'm still finding it really difficult because I'm used to leaning to my right to talk to you.
Yeah.
Yeah, but look, it's good to switch things up. And there's a reason why we've done this. Quite a lot of the things that we were building up on, where we were focusing on the sector to sort of say, look, what are the challenges in the sector from a practitioner perspective, from a governance and compliance perspective. So we're looking at the building blocks in a way to say, look, what does the regulatory framework look like? What was key legislation? What are the expectations? And how are organizations dealing with this? And what sort of training and development is required. We're talking about something really important today. When you look at innovation, when you look at technology, whether it's technological innovations or non-technological innovations, what are the drivers of those decisions? And if you look at pain points of the typical health and social care manager, what keeps them awake at night, and how are they balancing compliance and the really serious operational and financial issues and pressures in the environment that we have right now. So we want to tackle one of the biggest issues around adoption of technology, not from a theoretic perspective, but actually talking to someone like Lewis, who is talking to our clients, I should say, or customers.
Yeah.
So most of the time, you are usually talking to people that make buying decisions.
Yeah, decision makers
Yeah.
primarily, yeah.
Yeah, so it could be the compliance manager, it could be one of the company directors, it could be a registered manager,
Yeah.
depending on the size of the business.
Yeah, usually depending on size of the organisation.
Yeah, and if you're dealing with NHS, for example, larger organizations, the big private healthcare providers in the NHS, what sort of people are you dealing with?
It could be people in HR, like I said, it could be people running small clinical teams. It might just be that division or department that may need a particular requirement, whether it's a course, whether it's a bit of software, a tool, a solution. So yeah, with NHS, some of the job titles it can vary. It could be compliance officers, HR,
Learning and
reps,
development
learning and development
leads as well.
departments,
Yeah.
but also some people, like high band nurses and
Yeah.
things like that may
Yeah.
have been tasked with commissioning this.
Yeah. So I think some of the NHS trusts we've worked with, they have allowed, say, ward managers or team leaders, clinical leads, to actually
To sort problems
procure.
out and
Yeah, to
procure,
sort problems out at source and procure directly.
Mm.
And again, obviously, changes now, NHS England being abolished, and organizations like Skills for Health. We had a healthy relationship with them before, but now it's
Yes.
almost like they're a proper competitor now, aren't they?
Yeah,
Where-
they've gone
yeah.
Lone Ranger in a way. Yeah, they're now in the market to provide these services
Yeah.
rather than maybe working as more advisory
Yeah.
to people like us.
Yeah, in supporting,
yeah.
organizations as well. So look, the software that we're talking about here and the systems that we're talking about, we're relating to learning management systems, training management systems, and basic entry level compliance software, policies
Yeah.
and procedures. So a lot of these things would have been done manually. Even in my day working in the NHS, a lot of these
Paper-based,
things were paper based. They'll be sitting in a folder somewhere. Then they ended up putting them on digital folders, and it comes with its own pros and cons. There's this assumption that compliance software in health and social care, particularly, should be plug and play, right? So, what causes this mindset, to have a cheap, instant, all-in-one system that will sort all my problems if I'm a service provider?
There's three main areas really that I'd tackle in on. I think a lot of it is to do with how consumers buy and what our expectations are of buying now, whether that's whether we're buying something from our local takeaway, whether we're ordering a taxi, whether we're going in to an airport. I think there's this demand on tap and go sort of experiences, and everything's at your fingertips. I mean, it's like now you don't need to leave your house to get groceries.
Yeah.
You don't really in a day need to leave your house. I'm pretty sure all amenities can be brought to your door. And I think there is the element of that when people are looking at some of the more basic services we offer, particularly when it comes to things like online training. People expect it almost to work like, you buy a top or some clothing from a website, you expect it now. If you're paying for those premiums to delivered to your door the next morning. Some people don't even want to wait 2 or 3 days. They want it at the door the next day. Maybe they've got a night out, an event planned. So I think that sort of culture is a big problem, really, because people are just expecting, look, I've been told to buy this, whether it's courses, whether it's this subscription plan, whether it's this tool. We've even seen it, to be fair, with some of the free things we've offered. Even some of the toolkits, people are still... They almost think by downloading a training matrix, because we had thousands of downloads on that when we offered it for free on the back of one of these podcasts. And you're almost thinking, you can't just download it and it's just going to work, or someone's going to come in and say, oh, that's great. That's, you're ticking the box for this. You've passed. You're a great, you're good. You're very good. CQC aren't going to come in and do that work for you. So I think, culture is definitely one of the big problems. I'd say the second one is more around sort of the tight margins. The quality aspect, regardless of size of organisation, is not a big factor, unfortunately. We obviously, as a business ourselves, pride ourselves on quality because, we, as well as obviously margins we have to keep to, we still want to provide a good service. And we know that if we don't provide good services, things can come back to bite us, whereas maybe some other people in the market don't really care for things like that. They will just offer it. They'll undercut people. They'll come in and they'll get market share, and that's that's their business model. That's their prerogative. We don't have that sort of conscience, I'd like to think, as a wider organisation. But I think, like you say, especially in social care, for example, the margins are so tight. People are looking for solutions, and it's the old adage, isn't it? You speak to any accountant, finance person, people who manage budgets for big organisations. Again, we've said this before on this podcast several times. The first things people look to cut are training and development budgets above anything else. Even the office, the coffees, the teas. I'd still rather save an extra 50p because we've got to have our coffee and tea in the office, for example. So I think that's a big problem. And like you say, there's also the aspect of CQC anxiety.
That's quite a big one, isn't it?
Yeah, they're just. I know you're big on the phrase tick boxing. If people are told or they've heard from a similar friend down the road who's running a similar service, you need to get this. The local authority are hot on this. CQC are looking at this. Have you seen this on LinkedIn from CQC? Did you get that letter the other day? Did you go to that conference the other day? Then it's all of a sudden, oh, let's just get it in because then we look like we're being proactive when really you're being reactive. At the end of the day, many people look at CQC, I think, as almost like passing a test.
You prepare for the exam.
You prepare for the exam. It's like the old one, even when going back to when I was at school, teachers would know when Ofsted were coming. All of a sudden there'd be lesson plans being prepared. The classroom would be tidier. Teachers would be there before the class starts. The PowerPoint or the projector would be all set, and you sort of think, so
I wish
this
they did
week's
this every
different.
day.
So I think the problem is, how do you change that mindset? We come on here most weeks talking about culture, leadership frameworks, changing mindset. It's not a tick box exercise, but the problem is when you're running some of these services, and particularly, like I go back to social care again, they're so busy doing the day job. Even some of the business owners.
Healthcare as well.
Yeah, no, it's still a problem.
I worked in the NHS, and we still deal with NHS trusts that are so busy to even care about some of the basics that we're talking about here. Because whatever it is.
But particularly, like you say, going back to the margin point with social care, it's a big problem across the board, obviously. But CQC anxiety is a big one. And while people are being almost examined, let's call it, or audited against a framework, people are going to look at it like a tick box. And I know CQC are adapting how them, even the quality of the people going in to audit the organisations is changing, but even the auditing framework is going to be changing. And even with the single assessment framework announced a while back now.
They don't call it single assessment framework anymore because the whole idea of having a single assessment framework is absolutely ridiculous. It's laughable because you're saying our local trust here, Covenant Warwickshire, I think they employ about 8,000 people, if I'm not mistaken. They've got over 1,000 volunteers. How do you have an assessment framework for that trust? And it's similar to the one for the care home down the road. It's very different.
There was a lot of backlash to the labelling, wasn't there?
It didn't work. It didn't work. That's why they've silently dropped single from the
Yeah,
from
it's
the
just
title.
an assessment
Yeah,
framework.
yeah,
So, yeah, look, for me, there'd be the three key areas to
yeah,
home in on, and we could talk about them all day.
yeah.
But they're the
It's
three main
interesting
areas.
actually. If I go to CKC anxiety, I remember one of our clients. Actually, you probably know who I'm talking about here. Some years ago, they were so bothered. Really, we're doing all the stuff that we needed to do, and then they were asking me, "So, what are CQC hot on this year?" It's like, what do you mean? Says, no, no, sometimes they're hot on safety, sometimes they're hot on well led. I'm thinking, but safety can't work without well led. All these
Yeah,
things
yeah,
are
yeah,
connected. So there's an impression that if I find the answers in advance, then I can prepare for CQC.
yeah, yeah, yeah. So
It,
that exam
I've, n-
mentality again, isn't
I've
it? Yeah.
never understood that, to sort of say, look, it's a whole framework and it's tailored to individual organizations. So CQC are going to come in, or any regulator are going to come in and use the whole framework. They're not going to ignore failings in one area just because they're not hot on that area that particular year. But that's really interesting. So thanks for that. So look, you said the consumer culture, because we have Uber, Deliveroo, Amazon, and we expect our software to work just like that. I don't need training. I don't need manuals. I just switch it on and it works. Then you looked at margins, which is really interesting, and obviously CQC anxiety. But again, if we expand on that to say, if you're starting from that perspective, then there is a difference now between expectations and reality. To say, if I'm expecting systems to work a certain way, or maybe my friend down the road, they're using a certain system and they've promised me that it's doing all these things. I don't know what their culture is. I don't know all the other things that they're doing. But I know they've got a good rating with CQC, or they've got an outstanding rating with CQC. So it must work for me. So, from your experience, because one of the things obviously is you used to be our commercial director before you
Yes.
became the chief corporate operations officer. So you have dealt with clients, and even now your team actually is one that develops the system. Your teams are the ones that are doing the demos with clients. What happens when expectations hit reality? To say, look, what they're expecting and what they get.
Mm.
How do you explain that? Mm.
Yeah, I mean, again, I'll probably go back to sort of the three sort of step analogy here. I think one of the big ones is always reporting. When people buy or license or subscribe now with all the different models we have, e-learning in particular, people are expecting highly advanced reporting in particular. They want the system to do this, to do that. When really, when you look at actually what people have bought from a product specification point of view, or a service specification, or even if we call it deliverables, what's our deliverable as the provider? They're buying a very entry level product. They're paying really for the course.
Yeah.
A lot of our costs we swallow for things
the
like
system.
the system,
Yeah.
the storage of data, the storage of certificates, because all these things have to be stored securely as well, by the way. Everyone will know what's going on across the UK with cyber attacks and stuff. So even our costs in that department have shot up in the recent months. But I think there's that expectation that, all right, I've bought some e-learning, I'm paying £15 a user per year, pretty entry level sort of product stuff, but they want a lot more from it now, and that's probably due to the advancements in technology.
Yeah.
We did a podcast earlier this week on things like AI, but I'd say that's definitely one of the problems, in particular. Integration, I'd say, is another
Always
one.
a big one.
Always sort of a big one. People automatically think by getting your system in, it will be able to link things to their HR systems or CRM systems, or other compliance systems they have, because a lot of our clients are using, as again we've said on this podcast several times, multiple systems to cover the compliance bracket, whether they've got things for care planning, incident reporting, policies and procedure documents, and then maybe they just use us for the e-learning side, or they're licensing a part of the system. So I'd say expectations on integration is always interesting. There's been several interesting discussions, and even when you say to some clients, look, we have a development team. Our system is open to API integration. We can integrate with your system. There's almost that expectation that it comes as part of the entry level product as well. So I'd say, that's a bit of a problem. And for me, the final one is the customization side. People read what the product does. A product should always say what are the features of your product, your LMS, the software you're providing me. But then there's almost an expectation that they can customize it. Like you said earlier about my friend has this system down the road, they have this system, and it can do this, it can do that. Why can't yours do this and that? But it's almost saying, well, we told you what our system can do. We're not lying. We're not going to exaggerate on it. This is the features. It's an entry-level product, what you've purchased, and it will do entry-level things. If you want the system to do more, or you want more features or a wider usage, you'll have to increase your subscription plan. So again, I think customization's an interesting one. Even this week, we had an interesting client that was renewing with us, and they actually openly admitted they hadn't actually used the system for the last 6 months.
That's interesting. So they're paying.
So they paid for a 12-month subscription. They used it for the first 6 months because I asked our team to do an audit. You know, when was their last user logins? What have they recently done on the system? But the last reported action from them, either from an admin perspective or an end user perspective, was 6 months ago.
Yeah.
And then they're asking, can we do another demo? Can you remind us what the system does? And that's why I think it ties in nicely with this point to sort of say, again, these are some things that as a business we have to swallow those costs, because from a service point of view, I'd be mortified if we said we couldn't do that, but we're not going to obviously bill them to redo that demo, which is basically repeating what we did when they signed up 12
So
months prior.
what do you think are the reasons for people paying whatever amount of money for a system or for licenses, then they just stop using it?
It probably goes back to the previous question about pressures. You know, maybe they initially got the software in to fix a problem. Maybe CQC were on the way, or maybe they'd just visited and they'd said, you need to address this. The pressure side, the busyness side, and the tick box culture.
Yeah.
Because again, if certificates, in particular with e-learning and sort of the mandatory and statutory training side, if certificates are close to expiry or in most cases have already expired, there was probably a mad rush in that first 3 to 6 months to get things done and up to date. And then all of a sudden that problem is done until the 12-month cycle reappears. So that final 6 months, if they're not using any other part of the product, then they probably found no use for it. So they didn't log in. Yeah. And all that knowledge that they had has disappeared. But customization is another big one. Again, I think, again, because of advancements in tech, there's this over inflated expectation of what an entry-level product even should be able to do.
Because what's interesting is we have different models, isn't it? We have the basic entry-level model, which is mostly, you know, you are going to choose how many credits you want. Yeah, you set up. They don't even want a URL that will go on their website or as a sub-site or whatever. They don't want any customization at all. Typically, they want to tick a box.
Yes, those customers you can almost profile after what they've asked for, basically. Yeah.
And like you're saying, if they're not even bothered about quality, if they're not even opening it, that's quite interesting, really. It sort of takes us back again to say, when people know that CQC have changed the way they do things now, they are doing more inspections now, they are rectifying some of the issues that were there in the framework. And it's not just a list of things to have. It's not just having systems. They want to see the impact, the outcomes, the evidence of learning. How does it link then with the key questions? How does it link then with the I statements, the we statements? So if you're having a plug-and-play system that is cheap, all in one, it's quite clear that you're not going to meet. It's a starting point, yes, but you need to do a lot more. So from your perspective, how does that play out? I'm still talking about the reality, actually, of expectations and reality. How do people ask how these things fit into the CQC framework at all? Are they bothered about that?
We do get a lot of people. I think actually in the back of some of these things we're discussing, we do get even our receptionist will give me a report at the end of the month saying we just got a lot of people calling asking for a bit of advice. In terms of people that are actually looking to buy, you know, someone you'd call maybe a qualified lead in sort of sales jargon, a lot of them almost pretty much know the basic things. They'll reel off, you know, what's in a usual, what's mandatory, what's statutory. You might get the odd question about, is epilepsy mandatory, for example? And then you obviously have to tell them that, look, Have you done a matrix? What's in your policy?
It's up to you to decide.
What's the
isn't
local
it?
authorities? What's the local guidance like? What what sort of people are you looking after? You almost have to like go back to the business plan with them in a way. So, like I say, there are differing discussions that we'll have. What I will say is, a lot of people's approach is quite unique in the way they'll ask things, because they'll obviously want to come across maybe quite confident, like they know what they're doing, but really they're trying to get information from you. Because obviously it may appear that they sound quite incompetent if they don't really know what their staff should be doing. And these are, like I say, predominantly business owners or extremely senior directors.
Yeah, but then we had
organizations.
We had a call some time back. I think it was last year, where we had their internal lawyer, their director of nursing.
It was a panel of people,
about 4 people, and it was almost like we're telling them completely new information. And I'm thinking, wow, this is interesting. This is a large organization. Actually, they're growing very fast, and they've got the right titles. All these people have the right titles, but they don't know what training needs analysis is. They don't know.
Well, our most popular downloads, like I was saying earlier, the training matrix and the training needs analysis. But even one of the most popular blogs, if not, in fact, the most popular blog is where you've actually defined what mandatory and statutory training is. I think it still beats every other blog we've ever actually published as a business. So it does show that, going back to people like Skills for Health and these other organisations who are there to supposedly help people, maybe the messaging isn't clear, but I think it's also, again, the time element. People aren't given this enough time. Sometimes, like, even in our business, we speak to business coaches and things like that, where you listen to ideas about how you plan. Sometimes with these things, you do need to block serious time. It can't be discussed over a Saturday morning coffee. It can't be discussed late in the evening when you're tired. You don't really want to think about these things, because although a lot of it is quite basic once you know what you're doing, there is elements of thought that need to go into it. You have to be switched on. You have to think about this. You have to plan. You have to look at, you have to do some of the boring research and things like that to clue yourself up, but also surround yourself actually with knowledgeable people or organisations, associate with organisations that can actually help you, not just take your money.
This is interesting, actually. I think it fits nicely into the next question that I got from our customer support team. They were talking about digital literacy. And the impression I got was in the adoption process and implementation process and even usage, there are issues around digital literacy. And as you rightly said, some people don't want to come forward to say, I've not understood this. And then it becomes a hidden barrier then, in that sense, to sort of say, look, if you bring digital literacy into this, how much of the plug and play problem really is about skills and literacy, for using these sort of systems? Because I think the assumption sometimes is, if it's a plug and play system, somebody else is using it that they've recommended, then I should be able to use it because they're in our sector. We know them. So it should work for us as well. So, what are your thoughts around digital literacy being a barrier actually to better usage, better adoption, and better assessment of these tools?
Yeah, it's definitely a huge problem. I don't think it's a secret to anyone listening out there that health and social care adoption of technology is still a big problem. And that's why there's a lot of fear with the introduction of things like AI and stuff into care systems, because traditionally digital tools they've struggled to adopt. Like I say, we build our system on, we've always had the mindset of, say, a Steve Jobs. I'm not comparing our software to Apple by any stretch, but we like the simplicity of what that man and his team created when they created Apple products, and obviously look how successful it is today. We want things to be intuitive. We're not there to create complex systems because we know the market won't react well to that. But I think there's an element of readiness and planning, like I just said. I think people, like you just rightly said there, they've heard on the grapevine, or they've looked on Google or ChatGPT now even, who offers mandatory training, who's competitively priced, who's accredited. These are your options. We'll call or we'll fill in forms on their website, see what comes back. People almost, like you say, think that by the point of paying the invoice or signing up, that's it. Even with the onboarding, the amount of no-shows we get on onboardings, which obviously is a huge cost to us, but it's also a waste for that organisation as well.
They miss an opportunity.
They've missed an opportunity to learn. I think even assignment of people is a problem as well, where people are not assigned to look after this system.
So no ownership.
No ownership,
within the
Whose job
organisation.
is it to look after, roll this out, implement it? You know, when we look at procuring new software in our business, the amount of planning needed to look at who's doing this, who's doing that, what's the deadline or the milestone for this. Yes, it's only some of our products, like I say, very entry level. I'm not saying you necessarily need to sit and write a thesis about implementation of an LMS system, but the readiness, I think, and the ownership is another big problem. Technology adoption, I don't know necessarily how you teach that. I know obviously younger generations and the generations coming up that will be working in this sector will be more technology savvy because of their exposure at a younger age, whereas some of the current workforce or people maybe nearing retirement obviously didn't have that exposure when they were younger, so they're catching up. So whether it will continue to be a problem in maybe the next 25, 30 years, probably not as much. But I always think with new systems, like I say, there has to be a time allocation to know what you're doing, make use of things like onboardings that we and other companies in our space offer. You know, like you say, ownership is really, really important as well. And then having, like I say, some sort of implementation plan.
Yeah. And it's also one of the things is you mentioned something interesting there. My experience, and this is your experience as well, because I used to go out and do a lot of training in organizations. So you find that the healthcare side of things, people were quite tech savvy.
Yes.
Perhaps because their education, when they're training to be a doctor or a nurse or a allied health worker, there's quite a lot of technology there being used. And also, if you've gone through the NHS, you're using computers almost every day to check for blood results, send samples, booking things, and all that, and even decision support tools, early warning systems, and all that. So they've been quite exposed to tech. But when you looked at the adult social care side, it was less so.
Yes.
You're working with smaller domiciliary care companies, even some of the large ones, to be fair, and even the care homes. I remember some places where even the internet did not work well. We're trying to do something on site, but even the internet is not working well.
Yeah. So what chance have you got?
Exactly.
To even access these systems without a stable internet connection.
Yeah. So look, I'm quite interested because you know that a couple of weeks ago I went to the Patient Safety Congress, the Health Services General Patient Safety Congress, and I didn't hear people talking about digital literacy. Perhaps because most of them are coming from the NHS, where there's quite a lot of tech already. Yeah. And I ended up talking to one of the key people there who was presenting, and I said to him, because he was asking me what I do, and then I was explaining and said, look, but the bulk of our clients are actually in social care. And a lot of the things that you are discussing here, you're not including social care. Although we now have a Department of Health and Social Care combined, rather than having two separate departments, I feel that the conversation is excluding people that are working in the community, people that are doing the care work. How do you meet the government plans then, this 10-year plan? It involves us discharging patients to the community, being looked after in the community. It means that people in the community need to learn how to do clinical observations. They need to be able to maybe work with hospital at home systems and interact with clinical teams in the hospital. So I don't know, from your perspective, obviously we get the illusion then that we can have plug and play systems, and we assume that it's simple enough and there's no training needed. And do you think it's a false economy? Would you say that's false economy based on your experience, especially with adult social care?
Yeah, like you say, adult social care, particularly in our experience, in this space over the last 12, 15 years, they have been the ones that would struggle more. You'd get more support tickets, more support calls. Still now there's organisations where there's... I think the other aspect to think about here is also end user adoption.
Yeah.
Because we don't speak... Obviously, we have a B2C market.
Yeah.
Due to the nature of the products and services we offer. But obviously, now we're talking about organisations. We deal with the decision maker. Our team will sit on, we'll set up an onboarding with the decision maker or the decision makers who have delegated it to one of their team to look after this area.
So you might not actually have any interaction with the end user
at all.
who is the care worker,
Who's
or
the person
nurse.
doing a lot of this?
So you're talking to somebody who you are hoping now is going to pass that message
Relay
on
the information
and cascade the training that they've received appropriately. Again, do you think it's a matter of this is a problem as well, even in the NHS, to say who is the customer?
Yes.
Is it the patient? Is it the nurse or the doctor using the system? Or is it the finance department or procurement department? Do you think there's a problem there? And how do you address it?
I'd say there definitely is. It goes back to the previous point about implementation planning. Even part of the procurement process, because a lot of people in our space will offer the same things. They might frame it in a different way, but ultimately they're selling the same sort of stuff. Whether it's the same quality, whether it's accredited, whether it's as good, whether the software's better, worse, that's obviously part of your decision making. But how many organizations come to us and say, oh, could we sign up for a trial, for example? We want to give it to a few of our staff to have a little look. We do get companies that do that. So I don't want to say that everyone's not doing maybe the right procurement tactics, let's say, but not many. So I definitely think there's a gap there to sort of say, rather than blindsiding staff at times, our top FAQ from a customer support perspective is, how do I download my certificate? Now, where is that coming from? That's not coming from a decision maker, because they're probably not downloading certificates. They could be, because obviously they'll have a right to do some of the things that we offer, but predominantly 98% is going to be end user. So for me, that side of things, how people are procuring systems, how they're reviewing them, are they involving in the decision-making process some of the people that are going to be affected? Like you said, who is the customer? Are we involving all the right parties, or are we just leaving it to the big wigs who make decisions about money? You're not good enough to make that decision because it's not your job to make that. And I get some of these people, again, they're very busy.
Look, I remember a care home owner saying to me, is there something that I can do legally to give them ownership for this?
Yes.
So that it's not my problem.
So, yeah.
I'm thinking...
bounding them by law,
Yes, right. but also, I've read quite a bit in this area, because I did a lot of research in decision support systems, and where they worked best was when there was a regulatory need, and there were penalizations, so to say. Like in the NHS, for example, there's a certain audit. If that audit is below a certain number, then they tend to lose so many hundreds of thousands of pounds. Then people will do it, because then it's a carrot and stick system, isn't it? And you realize actually that a lot of the compliance managers and business owners, they are buying it so that they can ensure that the organization ticks those boxes and complies. What it then does after, even whether users actually are asked, oh, the system that we're using, what do you think about it? I think it's very rare, because on many jobs that I did in healthcare, I was never asked.
No.
Maybe because I was so low in the sort of decision-making process,
chain in a way,
but in the food chain. But again, you sort of think, I think we're missing a trick there, especially now.
I would say so,
In our own organization, I think I'm the second oldest person in our organization. A lot of our staff, our teams and contractors, they're very young people that have grown up with smartphones and tech. And even some of them actually, if you give them a chance to suggest tools for design or some AI tools that will be useful, they're using quite a lot of tools that I've never even heard of.
Than our research or what we think is a good idea.
Exactly. And I've learned actually to sit back and ask people to say, oh, what do you think about this? Can you talk to your teams and see what people suggest? And I'm always amazed, actually, and sort of thinking, why did I waste all my time all along then not asking these people?
Yeah, no, exactly. And I think, going back to your original point, I think that is a big issue where people, like I say, they almost just expect the organisation, whether it's non-clinical staff, clinical staff, carers, whoever it is, just to be able to do these things.
Yeah.
But what support systems do they have in place? I know then that brings us on to the other point about the pressures, the time, resources. Do they have time to teach people how to use a computer, to use a tablet, to do some of these things they need to do? But from an efficiency perspective, something has to give. So I always think if we put some of these things in place, yes, it might take time. Yes, we might need to put a bit of budget to it. But moving forward as an organisation, where will we be in a year's time? And then where will we be in 5 years' time with all these efficiencies we've added? I think people, again, training and compliance, it's a pain, it's the mindset, it's a tick box. People aren't really thinking about these things. They're not thinking actually maybe what the pressure it puts on the end user, the staff member. I'm sure they don't want to be doing some of the things they have to do, but if it's mandatory or particularly statutory, it's got to be done.
Yeah. So I know you did some quick fire rounds with me in some of the podcasts. So I wanted to give you back some medicine.
Thanks.
So we have a bit of fun here. I asked the team to put some myths versus reality so that we can reset expectations. So there's a method to the madness. So if I throw some common statements at you, you tell me whether it's a myth or reality and maybe a brief explanation. Yeah?
Yeah. That sounds good.
So I'm speaking from the decision maker perspective, the care manager or the business owner. If I buy a compliance system, it will keep me CQC ready by default.
Myth. You can't just buy a CQC system and expect it to do everything that CQC may ask of you. I don't think there's a system on the market that does that.
Okay. So the second one, they're too expensive. I can get everything I need for £50 a month from others.
Myth. You could probably get a strong foundation for, say, around that sort of price point. But to say you get everything and you will be rated an excellent organisation and bells and whistles, no, compliance isn't that simple. Yeah.
So you just want me to increase my budget then?
Maybe use the money more wisely rather than, say, increasing budget. But I think £50 a month, normally, many things in life, actually, if it sounds too good to be true, it usually is. Yeah. So I always like to use that adage, you know.
Okay. So I think I think I know the answer to this one because we talked about it at length. If the system is intuitive, staff won't need training.
Yeah, definite myth. We've got lots of evidence that I could back that up with. Look, what's intuitive to you may not be intuitive to me. Everyone's needs are different. So if you don't understand the needs of your end users or they haven't been involved, as I say, in the pilot process or the decision-making process, even if everyone's a green light, but then there's one red light where someone's not getting it, they're going to need extra support. Yeah.
And also even staff turnover, to say some key people leave.
A huge problem in the industry.
And, demands as well on the workforce, also other demands that can then stop them using the system altogether because they probably don't value it as much.
Don't value it as much, yeah.
Okay, so a few more. One all-in-one system is always better than multiple tools. We want to save money.
All-in-one systems are a myth. They often, from my experience and discussions, particularly with people who use these tools, service users, decision makers, they often under-deliver. Usually a sort of well-stacked plan of several tools often delivers, I think, better results as long as you've got the right integrations and these systems are talking to each other, which is usually where the problem is. That for me is usually better. It also spreads risk as well. If you've got everything in one system,
if it crashes
what happens? Whether it crashes or whether there's some sort of error, then does that mean your organisation stops? Yeah.
Even now, almost every week, there's a company that's been hacked, and they're being asked to pay ransom, isn't it?
Well, the one I heard on the radio today was a nursery chain in the UK has been hacked.
They're putting children's information online on the dark web with the parents and all that. It's quite scary, really, because we do work actually with quite a lot of providers in the early years
in that
sector
space,
as well.
It's very scary, and even for organisations like us, it's only a matter of time before we could be next. So
but we work hard and we invest a lot of money and expertise in that
area. In the cyber side, and like I say, from a cyber security side, our budget's increased heavily. we've got some extra people in the business helping us with those things. So
Yeah.
we're not worried about things like that, but you have to be mindful of what's going on. Yeah.
Yeah. So to close off our myth or reality section, we want to reset expectations. So you're talking to someone, and it's very clear that their expectations are overinflated, and sometimes actually you sort of think, is there any point even carrying on this conversation, or should we just advise them to go elsewhere? How do you reset those expectations without losing trust? You don't necessarily just want to get the business for the sake of it, but
No.
at the same time, you are realizing actually that the expectations are far too high. How do you have that conversation?
Yeah, well, like I say, we have ethical practices in what we do. Even people who work in sales, account management in our business, we're always trying to do the best for the customer, regardless of what some people may perceive. I think transparency is really important. I think it's being clear about what this actually does. If people, particularly on things like demo calls or initial discovery calls, they may be asking certain things, there's no point nodding along or saying, yeah, we could do that, or we might be able to do that. Let me go and ask. We try and be very clear. Look, this package does this. If you want it to do X or Y, maybe you need to go onto another system. So I say transparency is number one. I think number two, I like to say partnerships. Sometimes recommending mixing systems rather than pushing an all-in-one system, and just being honest with people to sort of say, look, if you want something that does incident reporting, care planning, whatever it may be, maybe you're better off going to a system that specializes in that.
Then we can help with the integration.
Tools, and then we can look at integration. We can look at filling in the gaps with maybe a bit of what our product may be able to do. And I think then, like you say, the third and final point would be looking at education. So reminding decision makers and leaders that CQC is looking at practice, not licenses. It's not looking about what training you've bought and has everyone done it? Has everyone passed? It's looking at making sure things are constantly being reviewed, updated, whether it's to do with policy, whether it's to do with training. Are you on top of it? Do you have reports and evidence to prove that these things are in place? The system is only as good as how it's being used. Bad data in or poor usage is still going to give poor output, as good as the system is, whether you're paying £10-15 a person or a license, or £50 a person or a license.
It's how you use it as well, isn't it? Localizing it.
How are you using it? Like you give that example of that client earlier where they used it for the first 3 to 6 months. The last 6 months, it's abandoned. That's why now we've got activity logs on our system, because it's there to actually, for you as the user of the system, to prove that you are using this continuously, you are updating it, you are monitoring it. But also on the other side, maybe for reality hits, for people to sort of say, God, no one's logged into the system for the last 3 months. What's going on? Has it fell off a cliff?
Yeah. And what I've seen, we did discuss this some time ago as well in one of the sessions. I think we had a webinar with health and social care managers and leaders. And I was saying to them, we have actually looked at all the organizations that were rated inadequate. And the inspection framework now is so granular. They look at systems. They actually look at systems to check when was the last time that people logged in.
Yeah. It's a big thing now.
Yeah, what you are saying you are doing, is it backed up by the system that you are using? And in vast majority of cases, for those organizations that are needing improvement or inadequate, they're not using the systems. No. And the evidence is there that they're not using the system.
It's in black and white. It takes someone with any computer literally 5 minutes to work it out.
Yeah.
Even asking some basic questions. So how are you using X system? Because a lot of these people who are checking will know about all these systems because they do it for a living.
Yeah.
So you can't hide. Yeah.
So you know that I like checklists. Thanks to Atu Gawande, the checklist manifesto. So as part of our takeaways to close this session today, if I was to say to you, give me some practical things that I can do and improve my compliance in this area within the next 30 days, is that doable? Are there things that I can do that will shift actually where we are within a month?
I think you could definitely make a lot of progress by having that sort of mindset of like a 30-day checklist. I know our team are actually going to prepare one that we will be giving out for people to look at. But yeah, in terms of how I'd structure that checklist, I'd be looking at priority. So decide what is top need. Is it a compliance? Is it evidence? Is it workforce development? Is it integrations? It's important to have a purpose and a focus. Rather than maybe trying to solve all the problems at once, which a lot of people obviously try and do to save time and save money.
Yeah.
Budget to ambition is another big one. We've sort of hinted at that throughout the podcast. You're not going to get champagne results on a lemonade budget, to use that sort of analogy. Ownership, so have someone in charge within the organisation that is accountable, someone that has the time to do it and it's within their job specification. Make sure they manage things like your onboarding, the evidence uploading, the reporting side, and make sure that they're using it frequently. They're looking at their mailing list for updates that we're doing. They're checking what we're doing on socials and on our website, because we're always adding new things as well. And some of these things you don't actually have to pay any more for, but they could actually help the organisation out a lot. Like I say, schedule onboarding and refreshers. We're doing a big project at the moment where we're redoing our video tutorials that are going to be put on YouTube, the website. It's going to hopefully revolutionise our customer support side of things, particularly for end users, who are usually the people forgotten from a business procurement perspective. So look at booking your onboarding with your provider, whether it's us or be someone else. Look at refreshers, check in with the provider. We actually ask our account managers to call everyone, every 60 to 90 days at a minimum, just to check in. The problem is a lot of those calls fall on deaf ears, or emails fall on deaf ears. No one wants to speak to us
Until they want to tick the box.
Yeah. Normally, at the end of a subscription or just after a visit from CQC. I think another key point is mapping inspection evidence. So draft how you'll show effective training, policy engagement, learning in practice under the CQC framework. That's, again, where people with tick box mentalities, they lose out. And for me, look, 30 days, I'm not so saying you can do all those things, because I appreciate these businesses never stop. It's not like a shop front that can, shut at 5 and spend the evening to look at these things. But I think that would be a really good structure to improve things in terms of the technology adoption, but also getting what you want out of the technology. Because even, as we just said earlier, even being able to use the technology, if you're not using it well, you're not maximising what you can do with the technology, and you're not getting the output you desire. That's why the focus part at the start of that checklist is important. Then it all becomes rather pointless and a waste of money.
Yeah. Look, that's gold dust. And I'm also looking forward to seeing that checklist. I know it's a wider checklist, not just about what we're talking about right now.
No.
It goes through actually the adoption process.
Yes.
How do you choose software and what to look out for? The need to do demos, all those things are included. One book that I'm rereading right now is a book that was written by Terry Salt. So she was a CQC inspector, then she became an inspection manager. She's left the CQC now, and she does a lot of consultancy work and writing books. She talks about consultants and outstanding. What does outstanding actually mean? Which I like, because even my blogs, a lot of my blogs, I write them like that. You start with a definition in a dictionary to say it could mean something that is brilliant, like almost perfect product. But also, if you look at outstanding, it means that there are some things that are not finished. There's something that have not been done yet. And that's what outstanding means in health and social care. Even if you get an outstanding rating with CQC, you don't stop.
No.
The moment you become complacent, the
You're
moment
not
you stop
outstanding.
following the rules, the moment you think, wow, we've done it now, then that's it. You may actually need improvement.
You may go
or even become inadequate. So I like that. So if we were to think about that, actually, what are the big takeaways? We're talking about this illusion that we can just plug compliance systems and play. We should be able to use them like Uber or Deliveroo. I don't need a manual. I don't need to do a demo. And once I choose one, it should be able to help me with all these things. CQC see that, then commissioners see that, and they're very happy with. So what are the 3 takeaways that you would give to people, just to summarize our whole discussion so far?
Yeah. I'd say, yeah, the plug and play is an illusion. Although you've got very intuitive technology available, and even the services we offer, for me, the system's very easy to use. But it comes from a consumer culture that particularly we have here in the UK. That expectation that everything's on the edge of your fingertips and it's instant. It's an instant result as well. It's not just about the access, it's about getting what you want from the procurement of that particular service. You've obviously got things like the margins that we discussed earlier. We always know budget is a huge problem, budget constraints, pressures in terms of finding time to do a lot of this stuff. We appreciate it. It's very, very difficult. And sometimes smaller companies with smaller resources are going to struggle, and they'll continue to struggle. And inspection anxiety, that's another key one for the top section. Another part would be systems, like you say, that they're tools, that they're not silver bullets that are going to solve all your problems straight away. They're only as good as how they're being used.
Yeah.
It's really important that you understand what the system is there to do, you understand what the system can do, you keep in touch with the system or service provider to see what other continuous things you could keep doing. Because sometimes you're getting more value from what you've actually paid at the entry level. But if you're not keeping in touch with updates, if you're not checking in with the service provider, if you're not looking at what they're doing, you're missing out. And sometimes a lot of these things are free. Not all the time, but they can just be nice additions
To the system.
that could add a lot of value to you.
Yeah.
And I think the final takeaway would be success. It all depends on priorities, budget, and people. If those things are aligned, for me, people have the greatest chance of success and getting the results from technology in the industry.
Yeah. Thank you, Lewis, for being in the hot seat today. And thank you to our listeners who have joined us. I'd like to always say that, yes, some of these podcasts may sound like doomsday, but actually the vast majority of organizations out there are providing good to outstanding care.
Yeah.
They are. People really should be proud of the care that they're delivering. One of the, we always try to prepare our podcast in advance. We actually going to talk about that outstanding care, because in my years actually working in healthcare and social care and even academia, many people that you encounter, even when I worked in the NHS, they come to work to deliver excellent care every day, right? And sometimes actually it's the systems that get in the way.
Yeah.
And
they can be the barrier sometimes.
Exactly, the barriers. So next week, actually, we'll be talking about digital literacy and other barriers to technology usage and how they impact compliance. Because for us, actually, it's not enough just to talk about the problems. We actually want to give solutions, meaningful solutions that people can actually go and apply in their organizations and use meaningfully. So look, stay compliant, keep learning, and be very proud of the care that you deliver every single day. And even if you get a knock by maybe failing an audit or even getting a poor rating, we always should learn and then come back and deliver even better care next time around. So thank you for joining us. See you next week.
Thanks, everyone.